You wake up. Your head is being held down. Someone is standing over you with a sharpened stone. They are about to cut a hole in your skull. You are fully awake, no anesthesia, no painkillers, no sterile room, just you, the stone, and the person holding it steady. And here's the wild part. You might survive this. You might even thank them afterward. This is the story of how ancient humans performed surgery, real surgery, without anesthesia, and somehow some of them lived. Let's start with the oldest surgical evidence we have. It's called trepanation. Trepanation means cutting a hole into the skull, on purpose, while the patient is alive. The oldest confirmed trepanned skull comes from France. It dates back roughly 7,000 years. That's before writing, before the wheel, before most of what we call civilization. And the hole in that skull shows something remarkable. Bone regrowth around the edges. That means the person didn't die on the table. They healed. They lived for years afterward. Someone in the Stone Age performed brain surgery, and it worked. Now here's where it gets even stranger. Trepanation wasn't rare. Archaeologists have found thousands of trepanned skulls worldwide. Peru alone has produced over 800 of them. Ancient Peruvian surgeons were doing this constantly, and their success rate is honestly shocking. Some studies show survival rates above 80%. Compare that to Civil War battlefield surgery, thousands of years later, with far worse outcomes. So how did a Stone Age surgeon outperform 19th century medicine? The answer isn't magic. It's technique, repetition, and brutal trial and error. Let's talk about why anyone would do this in the first place. Ancient people didn't understand brain function the way we do, but they weren't stupid. They noticed patterns. Head injuries caused seizures. Skull fractures caused personality changes. Pressure on the brain caused problems. Releasing that pressure sometimes helped. So early surgeons developed a working theory. Bad things build up inside the skull. Let them out. Sometimes this was medical, a way to treat swelling after a battle injury. Sometimes it was spiritual, a way to release evil spirits or bad energy. Often it was both at once. The line between medicine and ritual barely existed back then. So how did they actually do it without anesthesia? This is where the story gets genuinely impressive. First, speed. Skilled ancient surgeons worked fast. The Incas reportedly could complete a trepanation in minutes. Less time cutting means less time in pain. It also means less chance of infection. Second, technique mattered enormously. Early surgeons used sharpened obsidian blades. Obsidian is volcanic glass. It can be sharpened thinner than modern surgical steel. A clean cut hurts less than a jagged one. It also heals faster. Third, they scraped instead of drilled in many cases. Slow scraping through bone layers, not blunt force. This reduced trauma to the brain underneath. But technique alone doesn't explain pain tolerance. So let's talk about what they actually used for pain, because no anesthesia doesn't mean no help at all. Alcohol was one of the oldest tools available. Fermented drinks go back over 9,000 years. Getting a patient drunk before surgery was common practice. It didn't remove pain, but it dulled awareness and reduced panic. A calmer patient was easier to operate on safely. Opium was another major player. The opium poppy was cultivated as early as 3,400 BCE. Ancient Sumerians called it the joy plant. By the time of ancient Egypt, opium use was documented in medical texts. The Ebers Papyrus, dating to around 1550 BCE, references pain-relieving remedies. Opium slows breathing. It dulls sharp pain. It creates a kind of detached drowsiness. Not painless, but bearable. Then there's mandrake root. Ancient physicians in Greece and Rome used mandrake as a sedative. It contains compounds that can cause drowsiness and confusion. In high doses, it can knock a person out completely. In lower doses, it just makes everything feel far away. Ancient surgical texts describe soaking a sponge in mandrake extract. The patient would inhale it before the procedure began. This is sometimes called the soporific sponge. It shows up in medieval surgical manuscripts too. Not a perfect anesthetic, but a real attempt at one. Willow bark deserves a mention here as well. It contains a compound related to modern aspirin. Ancient Egyptian and Sumerian texts reference it for pain and inflammation. It wouldn't knock anyone out, but it took the edge off. And then there's the coldest option, literally. Some ancient cultures used ice or cold water to numb an area before cutting. Cold reduces nerve sensitivity temporarily. It's crude, but it works to a point. Battlefield medics have used versions of this for centuries. Now let's talk about restraint, Because this part isn't pretty. For most ancient surgeries, the patient was physically held down. Assistants would pin the arms and legs. Sometimes the head was strapped or braced. This wasn't optional. Even a sedated patient can flinch, and a flinch during skull surgery is catastrophic. So multiple people were often needed just to keep the patient still. Surgery was rarely a one-person job. It was closer to a coordinated team effort. Let's move to ancient India for a moment, because this changes the whole picture. Around the 6th century BCE, a physician named Sushruta wrote one of the most detailed surgical texts in ancient history. It's called the Sushruta Samhita. It describes over 300 different surgical procedures: cataract removal, cesarean sections, even early reconstructive surgery for the nose. Sushruta's texts describe using wine and cannabis-based preparations for pain relief. He also emphasized precision, hygiene, and instrument sterilization by fire. This was thousands of years before germ theory existed. And yet the instinct was already there. Clean instruments, fewer infections, better survival. Ancient Egypt also produced remarkably advanced surgical knowledge. The Edwin Smith Papyrus, dating to around 1600 BCE, is essentially a trauma surgery manual. It describes wound assessment, treatment, and even prognosis. Some cases are marked with a chilling note: an ailment not to be treated. That means the surgeon recognized when a case was fatal. This is diagnostic honesty, thousands of years before modern medicine. Now here's the deeper meaning behind all of this. Ancient surgery wasn't reckless guessing. It was systematic knowledge passed down and refined over generations. Every successful surgery taught the next surgeon something. Every failure did too. This knowledge moved through apprenticeships, oral tradition, and written texts. Slowly, painfully, it accumulated. Modern surgery didn't appear out of nowhere. It stands directly on top of this ancient foundation. Let's bring this back to the body itself, because there's a biological piece people miss. Humans actually have natural pain blunting systems. Extreme stress triggers the release of endorphins. Endorphins are the body's own painkillers. In a genuine fight-or-flight state, some pain signals get suppressed automatically. This doesn't make surgery painless. But it may explain why some patients could endure procedures that sound impossible today. Combine adrenaline, endorphins, alcohol, opium, and sheer terror-driven focus. And you get a patient who is suffering immensely, but still conscious enough to survive it. Here's the turn in this story, the part that flips everything. We tend to imagine ancient surgery as primitive butchery. Random cutting, no real skill, just desperation. But the evidence says otherwise. High survival rates, detailed medical texts, specialized tools, documented pain management techniques. This wasn't chaos. This was a developing science, built entirely through trial, observation, and memory. And here's the twist that should genuinely unsettle you. Some ancient surgical outcomes were better than surgery performed centuries later. During the 1800s, before germ theory was accepted, hospital infection rates were horrifying. Doctors moved between patients without washing their hands. Wound infection killed more people than the injuries themselves. Meanwhile, ancient surgeons using stone tools and herbal sedatives sometimes had better survival numbers. Not because ancient medicine was more advanced, but because some ancient practices, by accident or instinct, avoided modern medicine's worst mistake: contamination. Progress isn't always a straight line, so think about that person from the beginning. Held down, awake, a blade against their skull. No anesthesia in the modern sense, but not without care, not without knowledge, not without someone trying generation after generation to make it hurt less and work better. Every time you get a surgery today with anesthesia, sterile tools, and monitored vitals, you are standing on top of thousands of years of people who didn't have any of that, and who tried anyway. That's the real story here. Not primitive people cutting blindly, but early humans refusing to accept that suffering was permanent, refusing to let injury simply mean death, building knowledge one patient at a time. Some of them lived because of it, some of them didn't. But the ones who lived carried that knowledge forward, and eventually it became the medicine we trust today. So next time you're numbed before a dentist visit or sedated before surgery, remember this. Someone, thousands of years ago, was doing your job with a rock and a prayer.